Good evening, everyone, and welcome to another episode of Affinity's COVID-19 webinar series. I'd like to begin by respectfully acknowledging the Gadigal people of the Eora Nation, the traditional custodians of this land. We pay our respects to their elders, past, present, and to all descendants who have cared for this place since creation. We also honour all other Aboriginal and Torres Strait Islander peoples who are joining us today. My name's Lisa McMillan. I'm a member of Affinity's advisory board and a journalist. I've worked for SBS and the ABC and a few other places. For those of you joining us for the first time, let me briefly introduce you to Affinity International Foundation. Affinity was formed by a group of young Muslim Australians in the year 2000. Affinity's aim is to promote multiculturalism and foster intercultural and interfaith dialogue by building bridges between different groups in society. The impact of COVID-19 has affected us all as a global community. Nonetheless, Affinity has decided to continue with their events online. The first of these programs began in the month of Ramadan with over 27 daily episodes of Ramadan conversations with facilitator, former ABC broadcaster John Cleary and TV presenter George Janikian, as well as many other distinguished co-hosts, guests and musicians joining both nationally and internationally. Let's have a look at the highlight video.
Hello there, and welcome to Ramadan Conversations. We're all in this together.
Yes, fasting is month of sharing, not just for Muslims as well as non-Muslims.
It's a very big question.
Based information.
And Affinity was extremely good group because it was focusing not on the religious differences, but at what is uniting us.
We're all living.
How do we thrive within this COVID-19 environment?
It's a community mission and everyone has a role to play.
We'll be much happier.
Big cracks that are
Can I pay tribute to Affinity Intercultural Foundation for your work throughout the community?
I think after a week of my cooking and my wife's cooking, my kids are looking forward to their grandma's cooking.
I'm really proud to say that on the whole, I think as Australians, we've kept our values intact.
And disinformation.
There is a very important correlation between controlling media and the quality of democracy.
Fake journalism.
It didn't become ugly. We held together. And Affinity is part of that spirit and part of that success.
as bystanders.
I'm always inspired by the efforts of Affinity, not just around Ramadan, but certainly then, their dinners, their iftars.
That they desire and be part of all of that is to go for it.
Have met with
COVID-19.
I want to thank the Muslim community right across Australia for everything you have been doing and the great example you have been setting and the leadership provided in your community.
As is possible.
Make or break year.
Balancing it.
The duty to reflect on the universe and as a book to read.
Cultural competency.
Affinity is part of the furniture now, as far as Australian multiculturalism is concerned.
What's important, but also how we're going to meet future challenges.
It's somewhat different.
Potential for a blessing.
And surely that's a Muslim and a Christian and a Judaic value. A value of collectivity.
The Nobel Peace Prize
Is that when we work to complement one another, not the fact that one is better or should be ahead of the other.
More tenuous.
Through meaningful engagement. This very program is just one example.
To weather the storm.
This kind of thing.
1,000 meals a day.
I can't stress how important iftar dinners and sharing and understanding of Islam has been.
Go Cats!
Follow him for the day.
The symptoms of it.
The fake news.
Have been established saying that religiosity can help people to overcome challenges.
Being Australian, there's a lot of good in there.
We work for each other and work with each other.
Muslim fans.
COVID-19 has stressed the need for people to understand each other and to come together.
How do you think? Privacy issues.
To use music.
And we would like to give a Roman taste to dialogue and mutual understanding.
Import of the interfaith dialogue in Rome and in Italy at the moment.
Prayer is the joining in cosmic worship.
But
that is the one thing that I have missed.
Subhanallah, Subhanallah.
The night of revelation, it is both a Jewish and Muslim practice for people to stay up all night.
A bit like Martin Luther King Jr. said, injustice anywhere is a threat to justice everywhere.
Faith actually has a very positive role to play in making a society very humane.
To love others.
And make them feel welcome.
Let's actually rebuild something better.
I wanted peace in my heart, and I was in peace, and the result of peace was that, I forgave.
I really enjoyed learning about Ramadan, and I'm really, really looking forward to hopefully next year.
Who are we?
The great work that you do.
The sort of approach that Affinity itself has taken. One in which you seek to have a broader understanding of what you believe.
Consequences for our actions.
Actually create.
There's no going back.
There are no barriers between science and faith. They complement one another.
Breaking the ice and building confidence has been really productive.
Believe in different things, you can have a different culture, different skin color, but sports bring people together.
I'm just extending my hand to the Australian Muslim community and demonstrating that we are the same.
This particular conversation about during Ramadan is one that is really, really important.
COVID-19 is an opportunity.
Which I think Affinity and other dialogue centres in our nation have really contributed to.
To find what common values we have, goals, and so it just strengthens us.
The interfaith.
Our culture is based on love and respect.
Which maybe will open the door and create some trust and build a bridge where we can start to talk about the ways that we're different from each other.
Through fasting, we are trying to empathize other people who cannot find what to eat at other times of the year. Empathy.
This is the last of our Ramadan conversations for 2020. I look forward to catching up again soon. Ramadan Mubarak.
What a fascinating and diverse array of talent. And if you're tempted to see more, these episodes are available to watch on Affinity's YouTube page. And now I would very much like to introduce tonight's facilitator, Philippa McDonald. Philippa is a senior reporter at ABC News and is currently covering bushfire recovery, as well as the impact of the coronavirus on regional communities. Her career has been built on breaking news and the analysis of the biggest stories of our time, from medical breakthroughs to the hunt for a serial killer, through to the Royal Commission, which revealed how the nation's most trusted institutions failed our children. Philippa has been there reporting for us. She's been at the centre of the media's coverage of Australia's worst bushfires, political upheaval, family violence, the disappearance of MH370, terrorist attacks, earthquakes, mine disasters, and coups. And she's here tonight. Welcome, Philippa.
Thank you, Lisa. We go back a way. It's a real pleasure to be here, and thank you for your warm introduction. Tonight we'll be discussing the mental health response to COVID-19. The COVID pandemic represents a potentially overwhelming challenge to our health systems, to individuals, and to our communities and society as a whole. How we respond to the many individual and collective challenges will impact our community for many years. The mental health impacts are both direct and indirect, affecting both personal and at a collective level. Our distinguished guest this evening is the New South Wales Chief Psychiatrist, Dr. Murray Wright. Dr. Murray Wright is a graduate of the University of Sydney Medical Faculty and has worked in a range of metropolitan, rural and regional centres as a psychiatrist in various leadership roles. He was appointed Chief Psychiatrist to the New South Wales Ministry of Health in October 2014. His clinical interests include consultation liaison psychiatry, emergency psychiatry, psychiatric and substance misuse comorbidity, psychiatric impairment among health professionals and police officers. In addition to his public sector roles, he has maintained a private practice since 1990. He'll outline what he anticipates will be the mental health challenges, how they're being addressed, what's planned for the future, with a particular emphasis on the role of each individual and their communities in helping to achieve the best outcomes. Now, before we begin our conversation, I'd like to inform our listeners and viewers to write down their questions in the chat box using the hashtag AskAffinity, and we'll try to answer them in the allocated Q&A session at the end. Welcome, Dr. Murray Wright.
Thank you, Philippa.
Now, the public health system has been applauded for much of its planning to cope with COVID-19. Testing, ICU beds, getting in more PPE. But what about planning for the demand for additional mental health services? What have you been doing?
It's a good question, Philippa, because I think that when the pandemic broke, like any other disaster, there's an immediate need to address some acute health issues, and quite often the mental health issues fall into the background. But in fact, we've been planning for something like this for years, if not decades. There's a planning process for disaster response, which comes into play as soon as something like, in our case, a pandemic. Before that, bushfires. Before that, the drought. All these things put all of our communities and many people under enormous pressure. And when it becomes a disaster, we know from research over many, many years what the impacts are from the mental health perspective. So we activate a plan, and we know that there are different phases in a response to a disaster such as a pandemic. There's obviously the acute phase, which is what I believe we're still dealing with, and that's really dominated by, firstly, the shock of the changed environment and the immediate threat that we're all facing. So we are, and it's mostly to do with fear, and it's a fear of infection, or it's actual infection. And fear is an enormously stressful thing for people to face. We know from past research that the individuals who are most at risk in this acute phase are obviously those people who are directly affected. So people who are in the areas where there's large community spread, or people whose daily lifestyle is severely affected by either the pandemic itself or some of the restrictions that are placed on us. The people who are most likely to get into difficulty are those people who actually already have some kind of health vulnerability, and that could be a physical health vulnerability or a mental health vulnerability, or people who are isolated. And that's why I'm really excited to be giving a talk here tonight, because I think that it falls to all of us to kind of look around us in our immediate circles and in our communities to try and seek out those people who might be vulnerable and who are relatively isolated, and to try and ensure that they get the kind of support that they're going to need.
Well, how do you suggest we do this in a time of a pandemic? How do you see it working? And if I could just ask you where you see the role of faith networks playing in there.
Yeah. Well, I think faith networks become very, very important as one of the things which enhance cohesion in our community. What we know from past research in looking at where communities have been impacted by severe disasters. Now, we haven't had a pandemic like this for over 100 years, but the research that's been done on other forms of disaster, such as bushfires, floods, droughts, etc., those things are not dissimilar. And we know that some communities do better than others in the aftermath of any kind of natural disaster, including a pandemic. And one of the factors which makes a huge difference is community cohesion. Now, how do you measure that? That's a really difficult thing to say, but there are some things that go into community cohesion. And if there's a shared faith or a shared belief system or a shared purpose, those are things which hold people together. And there's absolutely no doubt that working together makes a huge difference in terms of the outcomes, not just for the community, but for the individuals in that community.
And describe some of the little things that you think make a difference in community that people mightn't think of, whether it be lifting the phone and ringing someone, or what are some of the ideas that you could share with us?
Sure. Look, I think that it actually begins with looking after yourself. This pandemic is teaching us that this sort of adversity is not a sprint, it's a marathon. It's a very, very long-term issue. And so we all need to be in good shape at the end of this as we are at the beginning. And so I think that in trying to help others, it's really important to look after yourself. Now, I give this talk to health professionals because health professionals are particularly vulnerable. They're generally geared towards trying to put other people's needs ahead of their own. It's actually quite important to practice what you preach. So it's important at this kind of time, because everything has changed, is to monitor one's well-being, and that. Because the sorts of things that keep us healthy, some of those things are not available to us as easily as they would be under normal circumstances. For instance, if you're someone who has particular social pursuits. Now, you were asking me about faith. Many churches have gone online, or they don't have the availability of in-person meetings. Now, that's an enormously important part of the routine and the sense of well-being for individuals. If you don't have that, then you've got to be much more deliberate about how you maintain contact with the people that are important to you, whether they're your family, your friends, or people who are part of your community. It's important to keep track of things like your levels of exercise. Many people, obviously, during a stage 4 lockdown, it's actually not that easy to maintain regular exercise. But exercise is very, very important to mental well-being. And so trying to develop a routine that can be maintained during a pandemic is important. Monitoring sleep is important. One of the things that happens when people get stressed is it's actually quite difficult to switch off and to relax, and that's something that's a prerequisite to falling asleep. So many people who are under stress and worrying about the consequences of the pandemic can experience sleep difficulties. Keeping track of that becomes important. And if you get into the habit of keeping track of these things in yourself, then it's pretty easy to then translate that to asking the same questions of the people around you. And I think it's important when, obviously, as I said before, keeping regular social contact with people who are important in your life is one thing, but it's more about reaching out to those others who might be on the periphery of your network. The neighbour who has been recently bereaved, or someone who's moved new into the district and doesn't really have many people that they're acquainted with. The person, a single parent who's looking after the kids at home and when the school's closed down. You can, if you pay attention, you can identify people who might be a little bit more vulnerable. People often worry that if you ask someone who looks like they might be under stress how they're coping, that somehow that's going to make things worse. Nothing could be further from the truth. I've spoken to many people under enormous stress over many years, and one of the things that people who are very stressed or depressed find most difficult is when everyone walks around them on eggshells and doesn't ask them the obvious question, which is, are you okay? Can I help? Is there anything you want to talk about? You don't need to be a clinician. You don't need to be a therapist. You just need to show genuine concern and give the person an opportunity to talk. And then it flows from there.
Well, Murray, let's hear from Noyanika Bhattacharya, and she's got a question for you.
Good afternoon. My name is Noyanika, and I am from UN Youth New South Wales. My questions for Dr. Wright are: 1. How do we support young people who are prevented from accessing mental health resources due to socioeconomic factors? Secondly, where can young people access culturally LGBTQIA+ friendly resources or contacts to speak to counselors who will provide appropriate advice and guidance? Thirdly, the pressures facing young carers during the pandemic have shown the increased need for strengths-based and holistic approaches to mental health. How can communities, organizations, and service providers advocate for the representation of young carer voices?
So quite a few questions there, Murray, but all to do with young people, and let's hear what you've got to say.
Okay, yes, there's at least 3 questions in there. I think the first one, which is how do you access services, I think that's a really, really important issue. And one of the things that has occurred during the course of the pandemic is it's helped us to bring forward changes which might have taken a longer time to implement under different circumstances. And we've been interested for quite some time in the possibility of technology being able to assist us to provide better access. Because one of the good things about mental health is that you can actually do quite a lot using communication technology. You don't necessarily have to be face to face and in the room together in order to get a benefit. So and in New South Wales, sometimes the access issues are geographic, and sometimes they're financial, and sometimes there are other kinds of reasons why people can't access. Sometimes it's services are face-to-face services are restricted to business hours. So what we've got is, firstly, there's been an enormous explosion in the use of telehealth, which is using technology such as we're using tonight. The platforms such as Zoom and Skype and this platform are all tailor-made for mental health consultations. So that means that people who would otherwise be restricted for geographical reasons can actually get access to services. In my private practice, the practice went entirely telehealth in April, so that we were seeing all of our patients were being seen via either video or via telephone, and that allowed all of us to continue working, and it meant that nobody was putting themselves at undue risk of exposure. So that's been enabled partly because the Commonwealth Government and Medicare made it easier to use telehealth to access health services and mental health services. We're hopeful that the Commonwealth will continue that after the pandemic is gone, because it makes access easier. If you don't have to drive across town to see your favourite therapist or other practitioner, and you can do it using your computer, then you're more likely to connect with that service. So that's one.
But we're talking about a specific cohort of young people and services which are directly focused on young people, and as our speaker said, on culturally diverse, LGBTQIA+, kids, so, and young people. So they mightn't have a private psychiatrist.
It's not necessarily private. I mean, the use of telehealth is across the private and public sector. My point is that there are for some individuals that they're looking for a particular kind of therapist, and there are likely to be those kinds of therapists somewhere in the state, and you've got more chance of accessing them without the geographical barriers. There are also adolescent and child-specific services, and the kids helpline is an initiative across the country which provides appropriate, I guess, services for children and young people. It's a contact service, and it helps to provide advice and also pathways into care if that's what's needed. I think there's also a number of online services are available, and these are not face-to-face, person-to-person services, but rather the use of software programs and interactive programs to provide access to services. It's not a perfect solution, but I actually think that the intelligent use of technology can go some way to addressing those kinds of issues. I think the issue of any kind of vulnerable and minority group is actually very important when it comes to the impact of not just the pandemic, but the economic disruption that's been caused by it. And young people are much, much more vulnerable, and we're quite conscious of the additional pressures of young people whose sense of hopefulness about the future is being kind of severely challenged, and so there is a need to pay particular attention to young people, and I think also particularly LGBTQI children and young people. They are more at risk of developing mental health issues, and they are more, and so there is an effort to try and provide particularly appropriate services for them as well. It's not perfect; it's far from perfect, but we're very keen to develop and adapt as time goes on.
And have you seen a big take-up in the services available?
Yes, we have. And again, one of the things, and this is going to make me sound a bit like a bureaucrat, but one of the good things that's come out of all of this is that we've got much more comprehensive and timely data, which tells us what's happening. And so we are now seeing in my organisation, we're seeing on a weekly basis what the uptake of the telephone-based services is, and we're seeing that both on a national level and a state-based level, and we're able to compare that with the same time last year and make comparisons with how things are trending. We also have a lot of data on the number of people who are attending our emergency departments with mental health issues and with self-harm. And so we're keeping track of that, and we can look at that both on a state level but also down to local regions. And that's important because we think in the medium to long term there are going to be some parts, some areas and some subgroups and age ranges and individuals who are more at risk, because we want to make sure that if there's a need to increase services or to change the way we're presenting services, that we're able to do that in the places that need it, rather than try and have a one-size-fits-all approach.
And could you just tell us what those trends are telling you at the moment?
Yes. Look, in the very early part of the pandemic, and so I'm talking about March and April, what we saw was a reduction in the number of people who were attending hospitals, and we also saw a reduction in the number of people going into GPs. Now, we understand that was for two main reasons. One reason was that people didn't really want to go to places where they might have a higher chance of catching or being infected, and so they were tending to stay away. But the other reason, which was a concern to us, both in mental health and in health generally, was that there were some people whose reasonings were more altruistic. They were staying away because they thought they didn't want to burden the health system with their with their relatively trivial concerns, except their concerns weren't trivial. And if you don't, and so we were concerned that people were delaying coming to a health system because they were worried that the system was going to be overwhelmed with COVID. So we really needed to encourage people to seek care for anything, not just for the pandemic type problems. That changed in May and June, and it returned to what we would consider the sort of the normal levels for that time of year. But what we've since seen is that it's different in different parts of the country, and it does reflect the kind of pressures that our whole communities are under. So the telephone based services, which are really they're things like Lifeline and the Kids Helpline and Beyond Blue, that the calls to those did go up relatively early in the pandemic, and they've continued to stay relatively high, and they're higher in the parts of the country which have been more affected by the pandemic. And more recently, we're starting to see particularly young people seem to be under more stress, and so we are seeing young people presenting to our emergency departments with stress-related conditions and depression and suicidal ideation. And so we're really quite focused on trying to address those issues as effectively as we can, and that's where we're at. Well, then,
there's so much interest in this, Murray. So let's go to a question now from Murray Vickers.
My name's Margaret Vickers, and I'm concerned about young people's transitions from school to work and further study. This is complex at the best of times, but now it's even more difficult, with the exam processes being compromised, very few jobs to go to, and some problems, of course, at the university level. What advice do you have for young people themselves, or for their parents or their teachers, as to how they might handle what must feel like a sense of hopelessness, and certainly a lot less fun than it used to be? Thanks very much.
Yeah, this is a really challenging issue because I think that there's a certain amount of what young people are dealing with, which is a reality. You know, what most people who are getting towards the end of their high school years thought that they were going to go through in 2020 has turned out to be utterly different. And it wasn't that long ago that I can't remember how important it was to sort of plan out the year and to deal with things in a predictable fashion. I think young people really need to have a sense of hope and a sense of purpose about what they're transitioning to after they finish school, or transitioning from any part of the education system to another. I think that firstly, identifying that this is an extraordinary situation that they are in, and that they're deserving of the additional support is an important starting point. I think that the comments that I made earlier about how do you look after yourself when you're under this kind of stress, and when you don't know how long it's going to last, and you don't know what the consequences are, I think one of the strategies that I often talk about is that the bigger the stress, the shorter the timeline you should focus on. So if you're under a lot of stress, then focus on today. Focus on the next issue that you're going to be dealing with, and try and stay as well as you can and do as well as you can in that particular issue. A lot of what causes distress for not just young people, but for everybody in a situation like the pandemic is trying to project themselves a long way into the future and try and imagine what it's going to be like if the worst case scenario happens. And I think that contributes to an excess of distress, and I think that's true for young people as well. So what you then reduce things to is to say, well, you do have some tasks to complete. You do have some things which you thought you were going to do which are not available, but you ought to focus on the tasks that are in front of you. You need to focus on your health. You need to look after yourself. You need to and you need to try and retain a sense of confidence and faith that the whole community and the whole world, in fact, is doing its level best to try and get us all through this so that we have the best kind of opportunity to get on with our lives at the end of it. Your job, and I'm talking to the young person here, that your job is to look after yourself and to tackle the tasks that are in front of you, and try not to be too focused on the things that you thought you were going to be doing but aren't available, or the things that you've lost. Try and focus on the things that you still need to do going forward.
Murray, I'm sorry, I have to ask this question, but many may have seen Four Corners on Monday night and be concerned about the health system's capacity to care for the acutely ill. What do you have to say to that?
Okay, so I also saw the Four Corners program, so I know exactly what you're talking about. I think that when I made my introduction to this presentation, I talked about the fact that in a disaster, which is what the pandemic is, the people who are most vulnerable to being impacted are the people who have an existing mental illness. And one of the reasons for that is because they are often fairly marginalised in our community and our society, and so they and they can often have difficulty fully processing the information that's out there. So one of the really important things for government and for the whole of community and for each of us in approaching the pandemic is to make sure that we've got good, clear, meaningful and helpful information which is consistent. And we hear every day that people get distressed when there are either mixed messages, ambiguous messages. This goes even more so for anybody who's already vulnerable by virtue of a mental illness. Clarity of information and good and information that can be easily understood, it becomes very important. My view is that the the mental health system has to be endlessly adaptive to the changes in demands that affect us. And it does get stretched from time to time. We are concerned that over the next 12 months or longer that there's going to be increases in demand. So I think that there are challenges in looking after the needs of people, even outside of a pandemic time. But there's been an increase in a number of the resources for the mental health services over the last 12 months or so, which we hope are targeted in such a way that we can meet the needs of the acutely mentally ill even better.
There. Look, we have a question from Ahmet Sayed Yildirim, and we'll take that now.
I'd like to start off by thanking Dr. Murray, Philippa McDonald, and Affinity Intercultural Foundation for tonight's brilliant program. My question starts off by acknowledging that health workers are doing such hard work and sacrificing so much to help Australia get through these challenging times. Their work cannot and will not go unnoticed within the community. My question is, what kind of strategies or support plans are being implemented to ensure that health workers and their families are well supported through the huge mental health burden of the hard work that they do? Thank you.
That's a great question. Thank you for that. Look, I think that there are many layers to the answer to this, and I think that one of the things that happened in Australia is that we got good warning about what could happen to our health system by virtue of the fact that the pandemic hit the Northern Hemisphere, and particularly places like Northern Italy and New York sometime before it hit us. And we could see what happened to the health system, and those health systems were actually overwhelmed. That meant that the health system as a whole in Australia was able to do some very detailed and thorough planning. And one of the most important things in looking after the health of the health workers themselves is to make very clear that they're being well supported. And so well supported means things like making sure that we do have enough ICU beds and ventilators so that we are able to meet the needs of the community if we become affected by the pandemic. One of the most distressing things for health workers is when they're confronted with someone who needs a service, needs an intervention, and that intervention isn't available, and that person then suffers as a result of that. That's one of the worst things that a health worker can ever have to deal with. I think the health system in Australia has done a pretty good job of rejigging the resources that we've got and allocating extra resources so that we believe we can meet the demand that may arise. But there's also been a huge effort both at a local level and at a state and at a national level to make sure that there are specific support services to ensure the well-being of health workers. I'll give you a practical example. One of these, it was early on in the pandemic when we weren't sure how many community members might be infected. So health workers were worried that if by going to work, not only that they would put themselves at risk, but they would put their families at risk. So one of the practical things that many hospitals offered was to put the health workers up in hotel rooms so that until it was clear whether there was risk to them and their communities, they at least could stay away from their families, so not have to worry about infecting them. Now that might sound relatively trivial, but I think that it actually helped. It helped those health workers focus on their jobs and to worry less about the impact on their families. There are also a number of specific support services, including psychological support services, have been made available to health workers. In some cases, they're on site in the hospitals. In other cases, they're run through organisations such as Beyond Blue and the Black Dog Institute. I think it's a crucial thing, because what we don't want to do is to lose our valuable health workforce, and there's a risk of losing people through infection from the pandemic, but there's also a risk through losing them through the impact of the stress. So I do believe that we're trying to address these things, and I'm hoping that many of those initiatives will still be available after the pandemic has passed, because I think that my view is that health workers and frontline workers deserve that additional attention because of the stresses of their day-to-day jobs.
And so, Murray, can I ask you, look, we've got terrible figures that show the shocking toll it's taking. In Victoria, almost 2,700 workers have contracted COVID-19, and most of those have been in the workplace. The stress that those health workers are under, and that the risks they take, being really quite heroic.
Yeah, and that they are heroic, Philippa. I mean, I think that it's a reminder that many frontline workers or first responders.
Dr. Murray Wright, can you hear me okay?
Yes, I can. it's a reminder that the frontline workers and first responders actually put themselves at risk when they go to work, and it's something that we haven't been confronted with in recent times because of the way medical science has developed, but it's very much in play for those workers at the moment, and I think that again the workers themselves, but also the health system, has reinvented itself and dramatically changed the way it does business so as to try and address that. But it's not without having that impact, because it is affecting the workers themselves. And I think you noticed that, in fact, I think it might have been either an ABC or an SBS story last night talking about how some health workers were coming from interstate to support the workers in Victoria. And I think that's something else you find at a time of disaster, and we certainly found it during the bushfires, is that there is an enormous willingness amongst our colleagues who are less affected and less impacted to step in to support their colleagues in the worst affected areas. So there's a kind of an esprit de corps within the profession, which means that people look after each other as much as they can in these times. But it requires, there's a lot of people who are doing roles which they aren't accustomed to. They're working outside of their normal roles. That also creates its own individual stresses, because you effectively have to learn to work in new roles. But it's almost the norm in many parts of health over the last few months that people have had to realign their day-to-day work to operate in a completely different fashion. And when we lose health workers, even if we lose them for a couple of weeks, and it's not just the ones who are infected, it's their colleagues who have to go into isolation, just in case they might acquire the illness. That puts the whole system again under enormous pressure. But I do believe the health system is working incredibly hard, and everyone is working above and beyond their normal efforts to try and adapt to that on a day-to-day basis.
And look, I'm sorry for the time delay my end, but I think this might be a good time to bring in a question from Dr. Imran about the challenges facing people who are feeling isolated, feeling depressed, battling maybe some issues with alcohol abuse. Let's hear from Dr. Imran.
Hi, my name is Nai. I'm a GP from Sydney Southwest. As we all know, there has been a significant increase in the alcohol consumption during this pandemic. I'd like to ask Dr. Wright if it's the same scenario for other illicit substance use in the community, and if the New South Wales government has any plan and policy to tackle its long-term consequences, particularly on mental health. Thank you.
Thanks again. That's another good question. I think that it would be remiss to have a discussion like this without talking about alcohol and drugs, because I think that they go hand in hand, unfortunately, with people who are vulnerable to mental health issues. Many people use alcohol and drugs as a way of self-medicating to try and manage their distress, and unfortunately, the difficulty is that with particularly with alcohol and illicit drugs, they can get a short-term, if you like, improvement from taking the drug, but the consequences in the medium to long term are devastating. Whatever the condition is that they're trying to manage, whether it be an anxiety condition or depression, it invariably gets worse with the use of alcohol and drugs. We're quite concerned about not just the increased use of alcohol, during the pandemic. We're also quite concerned about issues to do with abuse, neglect, and domestic violence because drugs, alcohol, and violence, unfortunately, go together. And I think that the pressures of lockdown, the pressure of losing one's employment or other restrictions that people are placed under, does in some instances lead people to using alcohol and drugs inappropriately. We start by trying to make clear the messaging out there that there's a risk of ill health, which includes the risk of misusing alcohol and drugs. We're very conscious of it in anyone who actually presents for treatment, but the concern, and I agree entirely with my GP colleague from Southwest Sydney, but the concern is that many people will have quite significant problems with alcohol before they present, and they very rarely present directly with a concern about the alcohol. It's usually something which is related, such as an injury. All I can say is that we would be very, very keen to suggest to anyone who is living with or is close to someone who seems to be misusing alcohol in the course of the pandemic to strongly encourage them to use other ways of stress management and to also to get some assistance with their misuse.
Briefly, Murray, and we're finishing up shortly. What about community leaders such as imams, priests, rabbis, and many more, and how they play a role?
Yeah. Look, I think that I talked earlier about cohesion and the fact that the more cohesive a community is, the better everyone is going to fare in this. And leadership goes, right from the top, from the leadership of the country, through the states, through the various organisations, and right down to leadership of communities and families, if I might say. I think that so leadership is something which is distributed everywhere, but there are some particular individuals who are looked upon at a time of community distress, and I would think that imams and other religious and faith leaders are people who are generally looked upon to give advice and support at a time of stress, whether it's personal or whether it's more community focused. I think hope is a really important commodity, and I think that it's important to not lose hope. I don't think we've got any reason to lose hope. My view is that this is the most extraordinary public health challenge that we have faced in 100 years. But we deal with challenges, and we're in a pretty good place in Australia. We've got a robust democracy. We've got more sense of shared values than differences. We've started with a healthy economy, and we've got good processes of governance and leadership. So I think that people who are in a prominent role within their communities, if there was one thing that I would be saying to them is to really project the fact that there ought to be hope, that this is something that we can get through. And it sounds trite, I know, but we can get through this, and the best chance of getting through it is working together and looking after ourselves and looking after each other. And I think that's a really important message from leadership figures.
Look, Dr. Murray Wright, thank you so much. And to end the night, I'd like to call upon Affinity's Executive Director, Amit Polat, to present the concluding remarks. Thank you.
Thanks.
pandemic, Dr. Wright and other distinguished health officers have been actively engaged in extending critical care to those in need, which has been of utmost significance to communities and individuals during the pandemic. Thank you to my esteemed cousin, Philippa McDonald, for facilitating another Affinity episode. We are proud to call you our cousin. You are my cousin. Thank you, Philippa. I would like to extend my appreciation to those who have been working hard in the background, Annalisa, Meredith, and Laurie from New South Wales Health. Finally, I would like to sincerely thank our esteemed board member, cousin Lisa, for the warm welcoming of the program. Now, more than ever, our obligation to help and support those in need takes on added meaning this year as our neighbors and communities face sickness, grief, economic hardship, and self-isolation. Perhaps the most difficult obligation for many will be following the long-planned gatherings, festivals, and celebrations to comply with precautions issued by authorities. But following these measures is a duty of our citizenship and a necessity of our social responsibility. Saving human lives and benefiting humanity are most noble endeavors. The Quran and other holy books liken saving a life to saving the whole humanity. COVID-19 is changing what is possible. I believe it is providing the potential for more connectedness through individuals empowering each other and communities uniting. This pandemic might be ironically bringing people closer. Humanity has overcome great challenges in the past, and we will find ways to overcome this challenge too. If we focus on the opportunities this pandemic provides, we will be able to keep our spirits high and reach the end of this tunnel much quicker. Joining an event like tonight shows that we are aiming to support and encourage each other to be ideal community, which is driving on the motivation of understanding, respecting, and supporting each other in this difficult time. At Affinity, we have had the honor to share ideas and connect with people from all walks of life during these challenging times. We have once again seen that human connection and dialogue, even though mostly online, continues to serve as a powerful means for health and well-being. I take from Dr. Murray and tonight's conversation that once again we can be hopeful that better days are ahead and we are all well connected and supported as Australian citizens in these challenging times. Finally, I would like to share with you Affinity's upcoming webinar episodes. Next Wednesday evening, on the 2nd of September, I would like to invite you all to Affinity's webinar episode in collaboration with New South Wales Council for Civil Liberties and Whitlam Institute. Join us for an insightful webinar with Ed Santo, Human Rights Commissioner, and Pauline Wright, President of Law Council Australia. This webinar will be facilitated by Dr. Graham Thorne, Refugee Coordinator, Amnesty International Australia. To stay updated with upcoming events, head on over to Affinity Intercultural Foundation Facebook page or Affinity's website. Thank you to our lovely listeners from home and our distinguished speakers and supporters. I look forward to seeing you next Wednesday. Have a lovely evening. Thank you so much.